Two eyelids, two objectives. Let's clarify the difference.
Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
Today we're going to be talking about the differences between double eyelid surgery and upper lid blepharoplasty. A recurring question I get is if double eyelid surgery is the same as an upper lid blepharoplasty, and if not, what are the differences? In this video, we'll describe the differences between these procedures, discuss anatomy, discuss the differences when it comes to the surgical procedure that's performed, and discuss the differences when it comes to the recovery process as well. Then we'll finish with a rapid Q&A session. Chapter markers are in the description for easier navigation. Let's start with the core question, are they the same operation? A traditional or just a standard upper lid blepharoplasty is essentially a procedure that reduces or removes excess upper eyelid skin, some additional excess fat near the medial part or the nasal fat pockets can also be improved at the same time. A double eyelid surgery, which is also termed an Asian eyelid blepharoplasty, is a particular type of eyelid surgery which involves the creation of a new crease, which is different from a regular blepharoplasty, which uses the patient's own existing crease. That's the main difference between these two procedures. A double eyelid surgery creates a new lid crease, so hence the patient now is able to see some part of that eyelid show, which was not present before, because the original crease that the patient had was very low, so low enough that sometimes it's not even visible because it's so close to the upper lid lashes. So double eyelid surgery is what I call a combination of aesthetic surgery and also reconstructive surgery, because you're creating a new crease in these patients that wish to have a slightly higher lid crease that now they can enjoy seeing some part of their eyelid to be shown. Unique Asian eyelid anatomy. To understand why these operations diverge, it's important to understand the anatomy differences in the Asian eyelid patient. In the Asian eyelid patient, the pretarsal fat sits lower. The lower lid attachments, the muscles to the skin, all are lower. Much lower, in fact, even closer to the point of where they meet near the upper lid lashes. When it comes to somebody that has a true eyelid crease that's present, let's say at 7 or 8 millimeters, which is the average in most patients, those deep attachments occur within the 7 millimeter range. So when somebody does not have a true lid crease, a lot of these structures within the deep part of the eyelid, meaning underneath the skin, are attached much lower. So the goal of the double eyelid surgery is to not only remove a slight or small amount of extra skin, but it's more importantly to go in and at a deeper level to identify these deeper structures and disinsert them, gently detach them from the skin structures, so that then the surgeon, meaning myself, can go in and recreate a new crease by performing these deep crease lid formation sutures. But the most important thing here is creating the crease, creating the new crease, and then going and identifying where these underlying structures are attached to and disinserting them, creating a pocket, and then once you're confirmed that this new lid crease is perfect, beautiful, works well with the patient, if I need to remove other structures, I may remove a little bit of fat that's prolapsed. In these particular cases, when I do double eyelid surgery, I often do remove a little bit more fat than I do with just regular upper lid blepharoplasties, because there's an excessive amount of fat that's present in my patients of Asian descent that are undergoing a double eyelid surgery, and that allows for me to kind of create a little bit more of an opening so that lid crease can really look well and heal well and last a long time. Rarely do I remove any underlying structures such as the muscle, but I do often disinsert some of the muscular attachments onto the skin to allow to that old crease to disappear and then allow for the new crease I'm creating to be strengthened. Now, what's also important with Asian eyelid anatomy is setting the crease. It does not necessarily correlate with setting the crease as I would in a patient of non-Asian eyelid descent. It's important to identify that I do not set my creases in double eyelid surgeries usually past 6 millimeters. I find that if you start doing a crease 7, 8 millimeters, or I've seen it in other patients done by other surgeons, the results don't last long, and more importantly, it does not look natural. It's a look that does not match the rest of their face, does not match their anatomy, and it creates a very unnatural look. And it also predisposes them to other risks that they can't close their eyes that well. They may have increased risk for dry eyes. So it's important to understand that where I set the lid crease is specific for my patient's eyelid anatomy, and it's usually a little bit lower than somebody that's not undergoing a double eyelid surgery, but undergoing upper lid blepharoplasty. There's usually a technique that's considered a non-incisional approach, and one that's an incisional approach. I usually perform my double eyelid surgeries through an incisional approach. I find that it's more direct. It addresses the extra skin. It addresses the lack of having a lid crease, and it addresses longevity. This is a procedure that lasts a very long time. Non-incisional approach is a procedure that I don't currently perform in my practice, but I'm well aware of how it works. It's a suture that's placed in and out through the eyelid without creating a direct incision. So it's placed from underneath the eyelid and within those structures to essentially create a higher crease. It certainly works in many patients. The problem is that it's not long lasting, and it also does not address the excess skin that the patients usually have at the same time. So that's why I prefer to do the incisional approach for the reasons I mentioned. A full incision approach not only addresses the things I mentioned, such as extra skin, creating a new lid crease, but it also can address mild ptosis that a patient may have. Oftentimes, patients that want and wish to have a double eyelid surgery have an underlying ptosis, or droopy eyelid. And that can be addressed at the same time. When I open up the eyelid, identify the deeper structures, I visualize that muscle that's slightly dehisced or loosened, and I can also tighten it as well before I end up closing up the eyelid, which is a beautiful advantage when it comes to performing a double eyelid surgery in an open technique or full incision technique. Let's talk about incision placement and healing. It's important to know that I carefully create my new crease at a place that's usually higher than where the patient had before surgery. My goal is to disinsert the old crease. So when all is said and done, when I use my fine sutures to close up, the incision is usually about in the 6 millimeter or so range, and then the healing process occurs. So generally, when I close up the eyelid incisions, I use deep lid crease formation sutures in addition to my running suture. So you'll see a series of little black interrupted sutures that are my lid crease formation sutures. These are important sutures that essentially create the new crease, but also fixate it and allow for it to remain in that position during the healing phase. And then I'll carefully use a running suture in between those, essentially close the superficial skin. The healing process is a process that I really spend time discussing with my patients because redness, bumps, perhaps some thickness to the skin, some hyperpigmentation is very common. It always gets better. I need to educate my patients about patience and knowing that the Asian eyelid skin generally has a more propensity for a little bit more thickening, a little bit more redness and hyperpigmentation. And I see that across the board with many of my patients that undergo double eyelid surgery. And that's one of the reasons why I developed Skinuva Scar Cream. I wanted to develop the most advanced scar cream that has clinically proven ingredients besides silicone that can not only help with the thickening of the scar, but also help with hyperpigmentation, but also help with redness. And so Skinuva Scar has all these ingredients that really help in improving all these sort of characteristics that we see in upper lid incisions. And so that's important for my patients to be reassured that with the use of this scar cream, at least 3 to 4 months, that you'll start to see an improvement week to week. Now, in those cases that there are still some stubborn areas of thickness, I will see my patients for a follow-up if possible for injections of a mild steroid with 5-fluorouracil to help improve and accelerate the healing process. It's not imperative, meaning that if you're unable to visit and see me, if you're somebody from out of town, you're still going to heal fine, but these injections tend to accelerate the healing process. So it's just important for my patients to know the options if they're able to fly in. Those injections can certainly help. Rarely have I revised eyelid scars. That's not something I normally do because the incisions generally heal very well with time. It's important to also stress that to my patients. Customization, surgical planning. What I love about double eyelid surgery is that there's so much customization involved in this particular procedure. In contrast to just an upper lid blepharoplasty where I'm using the patient's natural crease and removing the extra skin, double eyelid surgery, I have the advantage to speak with the patient about essentially designing this eyelid crease to their desires and to my desires and what I feel would work best for them. Meaning, what sort of height are we going for with the crease? Rarely do I go below 4 millimeters, but if some patient really wants a slight amount of eyelid show, then we'll aim for a lower crease, below 6 millimeters, for instance. There's that conversation to be had. Also, the shape of the lid crease is really exciting to talk about. What kind of shape do the patients want? Most of my patients love a nasally tapered crease where it kind of tapers in closer to the nose. Some patients like a parallel crease where it doesn't taper down in, but it goes parallel. Those are discussions that I have with my patient to see what works best for them. Generally, my younger patients enjoy that nasally tapered crease more than the parallel crease. What sort of shape do you want in the lateral part of the incision? I love a lateral flare when the patients are agreeing to it. It allows for a little bit more of an upswing laterally when my marking is made, so it gives a little bit more of an open look laterally to the eyelid show in that area, and patients usually love that. And that really gets a nice little added touch, a beautiful touch to the eyelid. So these are discussions that I like to have with my patients to really customize the double eyelid surgery to their desires. It's also important to address the brow position with my patients that are undergoing this procedure. A lot of times patients tend to overcorrect their brows because that skin is kind of resting against their lashes. So I need to evaluate the brow position. There's oftentimes what happens is after a double eyelid surgery, the brows tend to come down a little bit. So patients notice that there's more skin and hooding. Essentially what's happening is the double eyelid surgery is resetting the brows to their essentially normal position, their baseline position, whereas before surgery they were almost compensating their brows to be higher. I evaluate that to the best of my capabilities to assess that, and if there is an issue, we'll consider discussing a brow lift at the same time, or understanding the limitations, and may consider doing a brow lift perhaps at a later date once all is said and done with the healing and the recovery process. FAQ lightning round here. So first question is, how long did the results last? This is essentially a permanent procedure when all is said and done when it comes to creating that new crease. The new crease should last for a very, very long time. Sometimes it tends to weaken with time, but it's usually not common. These sort of procedures, after 2 to 3 weeks of the healing process, if the crease is still functioning beautifully, looks great, all the swelling is pretty much resolved, or most of the swelling resolved by then, that crease should last for many, many years. But the extra skin still occurs because we are essentially removing a small amount of skin, but as aging happens, now that you have a higher crease, there's still going to be excess skin that occurs with time. Again, we're resetting the clock, we're not stopping the aging process, so that extra skin can certainly be removed at a later date, 10, 15, 20 years. But what I do see in a lot of patients that have had double eyelid surgery, whether it's with me from years ago or from another surgeon, they're coming in thinking that they need a touch-up or removal of more skin. They actually need a brow lift because the brows have descended with time, and so a brow lift would be usually a perfect adjunct to elevating the brows to that position and then removing some of that extra skin, consequently by lifting up the brows. Beautiful result in a lot of these patients, so they get really excited to hear that one in consultation. Downtime. Generally, the sutures are in place for 7 days. That first week is important for my patients, so take it easy, reduce their screen time, reduce their time at work. I like to recommend them to take a week off from work if possible, but they can do some light work if they really need to. Again, it's important for them to rest their eyes. My patients generally will have a little bit of dry eyes, some irritation. Their eyes may feel tired or strained after the surgery, so important to take it easy for about a week. I will see you in a week and I'll remove the sutures at that time. You're not going to look 100% at 1 week out, but you can certainly start to work again, get active with using your eyes, taking frequent breaks as need be. I like to tell my patients by week 2, you should be presentable to see family and friends. Week 2, you should be able to exercise, apply makeup, and pretty much get back to most things in life, but you're not going to be 100% by week 2. I'd say 70 to 80% of your bruising and swelling will be improved by week 2, but when it comes to double eyelid surgery, there's a little bit more of a delayed healing occurring because of the new crease that I formed, and that swelling will still persist for several weeks to several months, but get better week to week to week. It's important to know that. Ptosis risk. Ptosis is always a risk with any sort of upper lid surgery, but it's pretty rare with either upper lid blepharoplasty or double eyelid surgery. What's important to note is that patients with double eyelid surgery will tend to have a little bit of ptosis from the surgery regardless because of the swelling. Because of the work that I'm doing within the deeper structures and doing a lid crease formation sutures, there's more swelling in the deeper layers, so there is some mild ptosis present in my patients that usually have double eyelid surgery. Overwhelming majority of the time, that ptosis gets resolved within a few weeks once that swelling gets better. Rarely do I see permanent ptosis. It's not something I normally see, although there's a very small risk, perhaps 1 to 2% of my patients may have that. Certainly fixable with a minor ptosis procedure that may need to be done if that's the case, but it's really not a big issue. So in closing, choosing the right technique is a nuanced decision that you make with your surgeon, and that's where I come in and discuss with you what your options are. There are patients of Asian descent that may have already a well-formed lid crease. They actually think they need a double eyelid surgery, but they don't. So every person is different, and that's where the goals of your eyelid surgery have to come in play with what I think would be the best outcome for you to give you the best result. In these particular cases, especially with double eyelid surgery, it's such a customized procedure where you're mixing aesthetic surgery with reconstructive surgery. It's very crucial to find a surgeon that excels in oculoplastic surgery, excels in cosmetic eyelid surgery and reconstructive surgery. Thank you for tuning in. I hope this is very informative. If there's any further questions that I did not answer, please drop them below and I'm happy to answer them personally. Hit subscribe for following me for any more information regarding oculoplastic surgery and my expertise and thoughts on that whole beautiful field.